Hello, I'm Dr. Christy Littrell. I'm an OB-GYN here in Dallas. I'd like to talk to you guys about what is a normal cycle and what is an abnormal cycle. So normally your cycle should be about 28 to 32 days apart, and the flow should usually be about 7 to 10 days. So there are some women who their cycle, they'll have spotting in between their cycle, or their cycle comes more irregularly, spaces out. Sometimes it comes really early, other months it comes really late. As well as sometimes your cycle's lasting longer than 10 days. Another warning sign that you want to talk to a doctor about is if your cycle is really heavy. And what is a heavy flow? So if you're having to change your pad or tampon every hour to 2 hours because of worrying about an accident, that's sometimes meaning your cycle's too heavy. As well as there's something called what I call doubling up, where you're having to wear tampons and a pad or tampons and a period panty to control the flow bleeding and not have an accident. So if you're having any of those kind of symptoms, you need to reach out to your pediatrician or an OB-GYN. So let's talk about when we start to use hormonal contraception. So hormonal birth control is used obviously for birth control, but there are other uses for it. So we also utilize it for if you're having significant cramping that is causing you, interfering with your daily activity. We also use it for acne, as well as if your cycles are really heavy or very irregular. So these are great options to talk to your OB-GYN or pediatrician about. Usually when I talk to patients about their heavy flow and cramping, we'll talk about using anti-inflammatories such as ibuprofen to help control their flow. So if you utilize or take those medications a day or two before your period starts, then it works really well at controlling how heavy your flow is, and it prevents the cramping before it starts. But you gotta know when your period's coming. And so if you don't know when your cycle is coming, then one of the best options is to look at using hormonal contraception. Now, what type of hormonal contraception should you use? Well, there are a lot of options. We traditionally start off with one of the pills, which is something that you have to take on a daily basis. And that's a really great option if you remember to take a pill every day. But there's some people, including myself, who cannot remember to take a pill every day. So there are other formulations, and one of them is a patch that you use weekly, and also a vaginal ring that you put in once a month. And a lot of women, especially young teenagers, are not comfortable with using that initially. So we like to use the oral birth control pill to help manage your cycle. Thank you very much. If you have any further questions, please make sure you reach out to your pediatrician or an OB-GYN.